Hi. So today we're going to learn how to pull up a client's chart in Profiler. Okay. So the first thing that we're going to do is from this main Profiler window, in this blue area is called the ribbon here. Okay. We're going to click on this button that says Navigator. It looks like a globe with a compass on top. Now, a lot of people want to do this, and it's very tempting to go to this little guy over here that says Find Client. That is an in-depth client search, and there is a lot of information you can put that in. You can use that for, excuse me, but for your basic charts that are already in the system where you're just going to pull up the information, it is much quicker and easier to do this navigator button here. There are some cases we would use that, as in before we create a brand new file, we do an in-depth search to make sure they're not already in the system before we create a new chart. But for 99% of our general purposes, we're always going to navigate the charts through this button here called Navigator. So we're going to select that. And then you'll open right up to a blank chart window. And then here in this particular area, if you know your person's name, you can type it right in. I have a chart called Tina Testing, and I can click on this search button here. Okay. Now, if it says no selection, that means that there could be more than one option with the name Tina Testing, and I can see that there is. There are two people with that name, different dates of birth, different ages, and different ID numbers. So this is where you need to know a little bit more information about your person before you can tell which one you need to select. In this case, I'm going to use this one with the date of birth 3/21/2001 that is 19 years old, with this ID number 123450. Okay. And then that will pull up her chart. One of the things that I really like about Profiler is that it always includes the person's name, date of birth, age, and ID number at the top of every window that you open of theirs, and that way you can always keep track of whose chart you're in. Okay, so we pulled up her chart by her name, and that is probably the most common way to do it, just because when we think of working with individuals, we know them by name. Obviously, they're not a number to us, so we don't always know their chart numbers right off the top of our heads. But you did see how there could be more than one person in the system with the same name, just like I demonstrated before. So an alternative way to look up a client chart is with their number. And her number happens to be 123450. Makes it a little bit easier for me to remember her test chart number. And I can do search. You can also select tab on your keyboard, but enter will not work. Okay. And one thing that I do like about the chart number search is that there's only one number for each person. So that is a very direct way to search. So I know I'm going to get the exact person that I want if I'm using that particular ID number. Okay, and you saw that it pulled her chart right up. Another thing that I could do is I could do testing space Tina, okay? Or if I don't know how to spell her name, maybe she has a complicated last name, I could put T-E-S-T-I-T-I-N in search. And again, I'm going to run into that situation where there's two people with the same name, okay? But you don't have to put the entire full first name and last name in if you don't know how to spell it. You could just put a portion in, and then it will either find your client if they're the only one in the system, or it will give you that drop down so you can select the one you want. The one thing you want to keep in mind that you cannot do, because it will not work, is if you do testing, comma, Tina, or whatever your chart name happens to be, okay? If I select the comma and do the search, I'll get a message, there are no clients that match the text entered. The comma is viewed as a character. Say, for example, we have some individuals in our system and in our staff even that have hyphenated names, apostrophes in their names. So the profiler system looks at those characters as a portion of their name. So you want to make sure that you do not put that comma in there. So I'm just going to click on OK, and I'm going to try again using the number, and I'll hit tab this time, and it will load it right up. Okay, so once I pull up the chart is going to have different sections here. You can see here, client, company, episode, cost center location, and TX plan or treatment plan is what that's short for. Okay. Anytime you're looking at a chart window that grays out, so see here, all these boxes are pretty light blue color, and then I get to company and it kind of dulls out and turns gray, and I've got no selection here. What that means is that the system has multiple options and it doesn't know automatically which one I want to look at. So I'm going to click on the down arrow, and then see here, I can see that she has had a couple of different company enrollments in our system. Now, one thing I can show you is that see how her number starts with a 1? This is a very low number, okay? So I know that we have had her chart in our system since even before our electronic health records went live. She had an old paper chart at one time. Okay. That's why she has an expired chart record from 2011. We actually started our electronic record in 2012. So I'm always going to select the active company, okay? Now all of those buttons light up and become that nice blue color, and I can access all of that information. Okay, it shows me that she has been active with the Norfolk Community Services Board in this particular enrollment since October of 2012. And then if I look on the down arrow, I could see that she also had an admission in 2011. Now, when you get to the episode level, the episode, and I'm going to click on that drop down arrow again, I can see that at some point she has left the CSV. She left on December 27th of 2013, and all of her programs closed out. So she was not currently active in anything at the CSB after 12/27/13. Okay, she took a break from any of and all of her services. She could have been lost to contact. There could have been another reason why she didn't receive services from us. Sometimes our individuals move, and so their services close, and then they come back to the area, and then they're eligible for services again. So in this particular situation, it looks like she ended her services 12/27 of 2013 and then returned 1/9/2014. And because it says active, I can see that she has remained active in some program or another since January 9th of 2014. You'll also see that there's a question mark on those. There's no end date. That means she's still open to the Community Services Board. Okay. Now here, this level, the name tends to be a little bit tricky. It says cost center location, and that typically makes people think of finances, right? Cost, how much money are your services or whatever. It really just means programs. I'm not sure why it's named that, but it's one of the things you want to think about. So that it just means program. If you could kind of drill that into your head, cost center location equals program, then you know, you'll have it very quickly. Now, because Miss Tina is actually one of my test charts, you'll see that she has been enrolled in a variety of programs. And that is just because we like to use her for practice to open programs. So most of your individuals are not going to have this many programs that they're enrolled to, but this is a good example of some of your charts. You open them up and they have been in our services a lot and they've accessed a lot of different services from us. So you may see a long list of services here, and that would be okay. The services are listed in alphabetical order by location. And you can see that we typically use abbreviations. So if you have any questions about what any of these programs are or mean, you can reach out to me. You can also reach out to your program supervisor and they can explain it. CAS, though, if you see that in front of any of our services, that stands for Child and Adolescent Services. So you know that those were services that were open and active for an individual who is under 18. Okay, and let's see, the ones that say active, you'll see a start date and a question mark. That typically means they are still enrolled in that particular program, if you ever see that. Okay, let's look at another example of one that is, oh, excuse me. So yeah, if you select one, like I just did, it will open up the treatment plan below, that's what the TX plan, associated with just that particular program. So since I selected that active child and adolescent, SA stands for substance abuse outpatient program, they've been active since 9/3 of 2014 and they're still active, so I can see that with the question mark. The treatment plan that's connected to it pulls down below, okay? So if I was selected a different one, so let's choose this eye care one that's expired. Okay, if something is expired, you'll see a start date and an end date here, and that means that they are no longer enrolled in that particular program. So you have access to view historical information in the profiler system. Just know that even though you can view it, they're not currently receiving services in that area. If I wanted them to receive services in that area, then I would have to make a referral and get them back open in that particular program. Okay, so those are the levels of the client chart, and then we also reviewed how to pull up a client chart in the first place. So just think of the chart as set up like an ice cream cone. Okay, so I know that's a little bit odd of a comparison, ice cream cones and health records. But the client level, which is at the top, is the broadest, okay? So the client level contains the broadest information that most people at the Community Services Board would need access to. So her demographic information is all at that top level, right? Her releases are all at that top level. Her appointments are at the top level. Anybody who works with Tina in this particular example needs to know that broad information of hers at the top. Everyone needs to know her birthday, right? Then we can verify her identity with everything at the top of her chart. The further down you go, based off of the selections you make, the more specific it gets to an individual program. So that's why I make the comparison to an ice cream cone. It starts off very broad at the top, and then based off of your selections and the different levels, it narrows down at the bottom and you just get very specific to just the information pertaining to the particular program that was selected. Okay, I hope this information has been helpful to you. Please don't hesitate to reach out if you need help, and I look forward to seeing you soon. Thank you.